Good afternoon, everyone. Scott Maybor here with your Medicare Missive from the pond for Wednesday, October 1st. Wow, so happy unofficial start of open enrollment. The official start is on the 15th of the month. And easy fast to those celebrating Yom Kippur this evening and tomorrow. So, for those of you who've watched my videos, probably know I'm not a big fan of open enrollment period. I think it's absolutely insane that we force all of our seniors to make a decision on their health care for the coming year in a 6 or 7 week period. I think the restrictions, so many of you have probably already received letters in the mail from either their carriers if there's a change, or Medicare if there's a cancellation of their plan, but I can't talk to you about your plan until October 1st or alternatives. Absolutely ludicrous. I think the whole system is terribly designed. I hate that people are locked into a plan. It's just the timing makes no sense. But one of the things I wanted to talk today about is about timing and why this is important to you. So open enrollment officially starts October 15th. As of October 1st, so today, anybody can talk to you about your Medicare plan options. However, yesterday I received in the mail an email from one of my software vendors that they are opening up the 2026 plan information at midnight today, so it's available. However, not all 2026 plan information is available. And he was basically saying it's not our fault. The carriers have not yet made it available to be uploaded into the various software systems. That's a problem. In past years, I've had all of the next year's information by Labor Day. So either just after Labor Day or before, I had all of the plan information, could spend the month of September organizing it and thinking about it and thinking about, okay, this client is losing coverage, or this client is losing dental benefits, or this plan's very attractive for next year in this county. This year, what they're doing is the carriers are not required to release their information until the 15th. And many carriers, unlike past years where they made it available earlier, many carriers are waiting until close to the 15th to release their information. Why I think this is important for you to consider: if you call me up today and say, hey, what are the plans available in XYZ county? I pull it up on the software, I have a list of plans. That's not a complete list, potentially. I don't know for sure if it is or it isn't. I won't know till the 15th if the list I'm looking at, and this would go for if you go to Medicare.gov, if you go to a Shine or Ship counselor, if you go to somebody else to help you, if you do it yourself, you don't know if that list is fully is complete until the 15th. So you may make a plan choice based upon the information that you're seeing today on the 1st of October. However, that there may be additional plans available to you that haven't been uploaded into the system because the carrier has opted not to participate until close to the 15th. So you're not getting the full picture, you're getting a limited picture. And I think that's really critical for early birds who want to make a decision quickly and get this behind them. Now, officially, you can't enroll until the 15th anyway. And honestly, so I can't take an application until the 15th. I don't know if that's true of carriers, to be honest. If you go directly to a carrier, they may be able to take your application because their rules are all different. They get to do all kinds of things I can't do. But be aware, if you're looking at a Medicare.gov or my software, or you're talking to somebody else, they're using some type of software, the plan list that they're looking at may or may not be complete, depending on if the carriers in that county that you're looking up have released all the plan information, some of the plan information, or in some cases for some of the carriers, none of the plan information yet. I haven't even had some of the broker meetings where they update us on the new policies coming for the year. I have 3 carrier meetings next week. They haven't even had them yet. So in theory, I'm talking to people today, starting today, about their new plan options for 2026. I don't even know if I have all the information, and I won't be certain that I have all the information until October 15th at midnight. So be aware of that, no matter who you're working with or if you're doing it yourself. The information may be limited and may not have the best policy for you, and you won't know for sure until you look in the 15th and can actually, when open enrollment officially begins, and can then make a fully informed decision. Let me know if you have any questions. It's going to be a crazy open enrollment. Happy to help. Feel free to reach out. Have a great day, everyone. Thanks for watching.